Hi, this is Jay Gosuico with EMT Paramedics on Facebook and my friend Roz Savage at rozsavage.com. And in this episode, diabetes. If you find this information useful or helpful, please feel free to share it using the button above, I guess, and share it with your medic friends and your corpsman friends on, and then catch up with me on EMT Paramedics on Facebook. All right, so diabetes. The good news is there's only 4 characters in the stories I'm about to tell you. The bad news is I'm going to tell it to you in a kind of a strange order. I'm going to tell you 3 stories, and I'm going to tell it to you in, I'm going to tell you the 3rd story first, the way it normally happens. All right, so my story is I'm sitting in a hot tub behind a fence, and I'm in New York or Chicago, and I'm kind of feeling, or San Francisco, and I'm kind of feeling a little lonely. But I'm sitting behind a fence in house sitting a friend's hot tub. This is what I thought about this story. So this fence is kind of cool because it's got a whole bunch of doors, and you can probably enter in any way you want. There's a whole bunch of doors, and all the doors have only one key, so it only takes one key to get into the door. Okay, there's a bunch of these guys running around because it is San Francisco or New York or Chicago, and they're general public, but I'm going to call them Sugar. After a good beer that I like, Lagunitas Brown Sugar, which apparently they're not making this year, so I'm a little bitter. All right, so I'm going to call general public Sugar. I'm going to call my locksmith, this guy who makes the locks, makes the keys for the locks. I'm going to call him Pancreas. And I have this guy. He's the 4th character in this whole story, and his name is Liver. And what Liver does is he makes an announcement to general public, telling general public that I'm lonely. So I have Liver's cell phone number. I have a direct line. He's going to be my announcer or my dispatch officer, and I have a direct line to Liver, and I say, hey Liver, tell everybody that I'm lonely, and Liver sends Sugar to come and hop the fence or get into the fence, right? So this is the normal way it happens. I'm sitting behind the fence, and there's a bunch of these guys, and these guys pick up the keys that Pancreas makes, and they come and join me, and we have a good time. All right. Every once in a while, since it's 2 in the morning, and I'm getting lonely, there's not a lot of sugar running around, so I call Liver. Liver calls Sugar and says, hey, Jay's lonely. So Liver transforms some of the fats and proteins that your body uses as stored energy, and sugar comes into the bloodstream, and Pancreas makes a couple of keys, and they go in. So those stories, that's the normal way it happens. There's only 4 players in that story, in any of the stories. Type 1 diabetes is juvenile onset diabetes, and it has a lot to do with an autoimmune disease more than anything else. And type 1 disease is when they're at a very young age, there's no locksmith. It took me about 15 minutes to draw this key, so I don't want to erase it. But there's no locksmith. The pancreas is there, but the function is wrong, so there's no keys to get in. So there's a lot of sugar running around, and this type has to inject their own keys in the form of insulin into the system so that it can work. So that's juvenile onset type 1 diabetes. There's just the pancreas is there, just not making the right keys for to get in. All right, type 2 diabetes. Now this is the one we're more concerned about. This is a lot more complex. Okay, so the reason why this is complex is the locks have changed a little bit. The locks are a little bit longer, a little bit thinner, you know, something's not fitting, and sometimes the keys work, and sometimes, a lot of times, they don't. And there's just something that's wrong with the locks itself, right? And so this is almost always caused, unfortunately, by race and ethnicity more than anything else. And then there's other factors that go in, like hypertension, a poor diet, a sedentary lifestyle, obesity, and smoking. And almost always, there's a combination, right? You've got a predisposed genetic issue that gets you closer to having a diabetic problem, but you smoke and you're not eating healthy. So you combine those and or other factors in, and your keys, your locks have a bigger chance, a greater chance of getting malformed, and the keys aren't fitting. So the problem with that is the pancreas is doing its job. It's sending out keys. Sugar is coming out to get the keys, but they get bottlenecked right here. I'm still lonely on the other side of the fence. I don't know what's going on. So I call liver, and I say, hey, liver, send me some sugar. And liver announces and sends over some sugar, and pancreas notices that there's sugar coming, and so he makes more keys, and I'm still lonely. And so this cycle just keeps happening, where pancreas is just doing his best to make keys, but he can't keep up. And finally, as you get into your diabetic coma stage, finally pancreas just says, I can't do it anymore, and gives up. And that's where the whole system kind of shuts down. So this is a high blood sugar episode, not a hypoglycemic, a hyperglycemic episode, a diabetic ketoacidosis type of episode where there's just a lot of sugar running around, the pancreas can't keep up, and then in the hospital we'll inject both IV fluids into the system and insulin into the system to help out the pancreas and bring everything back to normal. So again, fairly important that we know the complexities. How that's important to us as medics is that we'll see increased urination first. That's the classic sign of diabetes. Increased urination, and then because of the increased urination, what happens is the kidneys generally try to take back the sugars, but if there's so much sugars, it starts to overflow, kind of like water going over a dam. And at about 300 milligrams per deciliter of blood sugar, then that blood sugar starts to overflow into the urine. And what happens is, because of the sweetness of the urine, right, the blood sugar in the urine, you develop a thrush, genitalial thrush, and UTI, urinary tract infection. You're predisposed because of the sweetness and, of course, the dampness and the darkness of that area. Okay, so the other thing that the second symptoms that you'll have is increased breathing and increased thirst. They kind of go hand in hand as far as the oral airway goes, right? The increased breathing, you're going to breathe off the acetone, so you'll have a fruity smell to your breathing out, which is another classic sign of diabetes or high blood sugar, right? And then because of the urination, you'll have increased thirst. Again, with the sugary airway, then you'll develop thrush in the mouth because of that's just a great cavity with the sugar on board. Anytime you put a lot of sugar into, let's say, water, what you're going to get is syrup, right? Anytime you slow down the normal circulation with something more syrupy, you're going to get fatigue, and you're going to have, you're eventually going to develop peripheral vascular disease. That'll actually start out in the periphery and work centrally in. So a lot of your old-time diabetics started with maybe a toe amputee, and now it's going up into the ankles, lower limbs, and then eventually above the knee if this continues to be unchecked. Or some people, it's just very difficult to continue. They're so brittle because of the up and down swings they had in the past that it's even at their best, they have a hard time managing diabetes. Because of the sugar in the periphery, of course, you'll be prone to infection, and as a secondary, since there's a lot of poor circulation that's going on, then the healing's going to be poor. So not only are you prone to having an infection, but you'll have poor healing. And then as a side note, a couple of side notes, the sugars tend to elongate the cells in your eyes, and so therefore a lot of your diabetics will have blurred vision. Sometimes it's temporary, but most of the time it'll continue to get worse over time. And there is a gestational diabetes that happens obviously with pregnant women, but it normally goes away after the pregnancy. Sometimes it lingers and turns into type 2 diabetes. So there you go, diabetes, and some of the reasons why to keep that in check so it doesn't get worse and develop into chronic symptoms, chronic illnesses. All right, this is Jay Gosuico, and find me at EMT Paramedics on Facebook, and I'm supporting my friend Roz Savage, a solo ocean rower and environmental campaigner, and she's on Facebook, and that's her website, rozsavage.com. All right, shaka, mahalo, and feel free to share any of this information.